Good evening, Assalamu alaikum, and welcome to the Today Show. It's the first day of the last month of 2025. Did you guys realize this? Because I didn't. And I'm your host, Asma Amla, coach at British Cycling. I'm a mother of three, a cycling enthusiast, keen traveller, and foodie. I love taking on new challenges and have completed events like the T100 Triathlon and the London Marathon. I'm also one of the first Muslim women qualified in track, BMX and cyclocross coaching. I know, man, there's a lot about me. But yeah, enough about me. Today's show is packed with amazing guests, delicious cooking and inspiring conversations on spirituality, so stay tuned. Now, let me introduce our first set of guests this evening. We have Dr. Marina Parton, who is a consultant medical oncologist at the Royal Marsden and Kingston and Richmond NHS Trust. She leads specialist breast cancer clinics and is actively involved in clinical trials and national research. Tonight, she joins us to explain breast cancer symptoms, NHS screenings, and evidence-based treatment options. With her on the sofa, we have Pushkin Chowdhury, a 22-year-old student of History and Politics at the School of Oriental and African Studies. He has a strong interest in national and global affairs with a passion for art, theatre and cultural exploration. Love that. He joins us to share a young person's perspective on health awareness, stigma and early detection. Welcome to the show, guys. How are you all today?
Doing very well, thank you. Thank you for having us today.
No, welcome. It's great to have you guys. So, Dr. Marina, you are a specialist, you're an oncologist on breast cancer specifically. Can you tell us a little bit more about your job and your role and what you do at the NHS?
Great. So I'm a medical oncologist, and that means I work as part of a team that will help treat someone who's been diagnosed with breast cancer. The team would consist initially of a diagnostic breast surgeon, and once a breast cancer has been diagnosed through imaging, biopsies, then we have a team meeting called a multidisciplinary team meeting, and we'll have a number of specialists including pathologists, radiologists, radiation oncologists, medical oncologists such as myself, loads of long names, and we all get together and we agree on a treatment plan for someone with breast cancer so they get the best outcomes. And then one by one we will meet the individual to help deliver that plan.
Nice. Okay, so a very comprehensive team,
Yes.
working with loads of different people.
Great people.
And great, amazing specialists in the area. And we've got Pushkin.
Hello.
Hi. And so you are actually one of Dr. Marina's, the son of one of Dr. Marina's patients.
That's right.
Yes, so can you introduce yourself as well to the show?
Well, of course. So I'm Pushkin. My mum is Almona, and she was not recently, but relatively recently diagnosed with breast cancer about, I think, 4 or 5 years ago, wasn't it?
That's right.
And we were very fortunate to have a great medical team, including yourself, behind her all the way. And I think it's very important for me to come on the show.
Yeah.
Sadly, she can't be here tonight because my grandfather, her father's in hospital
Sorry
at the moment.
to hear
So
that, yeah.
thank you very much. But I'm happy to be here to represent, and I think it's a really important story to share for the community watching today. So thank you very much.
No, definitely. So we are trying to kind of break down all of these crazy names and, things that people kind of like are really scared about, long words that we kind of don't understand. And, and sometimes like an oncologist, like sometimes you're like, oh, what's an oncologist?
Yeah.
But you explained yourself, so it's okay.
So oncologist just means specialist.
Yes.
And so cancer specialist.
In cancer especially.
That's it.
Yeah. So there's loads of like the unknown, and a lot of people are very worried about the unknown when it comes to the big C word, cancer, really. And it is, I guess, very, very scary as well, because there's a lot that goes on in the background. Can you tell us, or maybe even simplify it a little bit for the viewers at home about what NHS does and how kind of the early detection of cancer comes through?
Yeah, thank you, Asma. So really important. We know that breast cancer is a common cancer. It's the most common cancer in the UK. About 55,000 women will be diagnosed with breast cancer every year.
Wow.
And the majority of these women will be treated with a combination of therapies and will be completely cured.
Okay.
So it's a very curable cancer.
Right.
And
okay.
early detection is key. And there are a number of ways to approach this. So first of all, there's a national screening programme.
Yeah.
So between the ages of 47 and 50, women will receive an invitation from their local screening centre to attend for a mammogram. And it's something called a 2-view mammogram.
Okay.
And this involves x-rays of the breasts. Now, some women may feel embarrassed to go. They may feel they don't need it because they don't have a family history or they don't have a problem. But if everyone attends and we can pick up those very tiny cancers early on, and then there's less treatment and there's a higher chance of cure.
Right. And as you've said, that early detection is so important
Yes.
because then it makes it more curable.
Yes.
And actually, breast cancer is one. It has seen very positive effects on the other side.
Yeah, absolutely, absolutely. So it's not just about the screening. So
Yeah.
the screening's once every 3 years and it goes up to 70 years of age. So people are being invited periodically. At least give it a go. It's never as scary as people think. And the other things in between that people can watch out for is for changes in their breast.
Okay.
So with the menstrual period, some women may experience changes in the breast, but if some changes persist, the lumpiness persists, or if there's a change in the skin, or a change in the nipple's inverted, there's crusting or bleeding from the nipple, or the breasts look asymmetrical when they looked symmetrical before, there's a change in shape, then they should go and make an appointment with their GP.
Right.
You can ask for a chaperone, you can ask for a female GP, you can ask for a nurse if you feel shy about it. And then from the GP or the nurse, they can be referred to something called the one-stop clinic.
Okay.
And that's within 2-3 weeks. They'll get seen in a specialist clinic and have a scan, a mammogram, maybe a biopsy, and we'll see a specialist. And they can be reassured straight away.
Yeah.
And the majority of women will be reassured and said, you're absolutely fine. These changes are not sinister. A small number, a cancer may be picked up, and then the cancer's been picked up early, their treatment can start straight away.
Right. So for the viewers at home, it's very important to understand that actually it's not as scary as you think. The mammogram is important, but it's necessary to find out whether you have any symptoms.
If
or,
you have, yes.
Yeah.
And the mammogram's key, but also actually being aware of changes in your breast and going to your GP. And many thousands and thousands of women do it every week, and the majority of women will be reassured. So you have that peace of mind. You don't need to keep worrying.
Yeah, it's brilliant to hear that because sometimes you do think that you know there's something different, and actually just go to the GP and just go
get it sorted, and you can just be reassured and carry on.
So you were talking about the ages, and you said it's from 47 to
47, 50, right up to 70. But you can carry on beyond 70 if you opt in. It's called opting in because a lot of older people don't attend. But you can carry on beyond 70 once every 3 years.
Okay, so you should be kind of keeping on top of it once every 3 years, and even if you have been already. You'll
get another invite, that's right. But of course, breast cancer can occur at any age. So even before that age, so for women in their 20s, 30s, 40s, if you have a change in your breast, go and get it checked out.
That's what I was actually going to ask next because you're saying 47 to 70, but actually maybe if you do see any changes earlier, even in earlier age, definitely get it checked out as well.
Get it checked out.
Okay.
Be reassured.
Okay, yeah. I guess it's better to be safe than sorry.
Absolutely.
Yes.